Dr. Fatunde, I would like to talk to you a little bit about some hygiene procedures. Now tell us of like some of the major mistakes people with braces make, and also, you know, some of the stuff they really should care while they have braces. You know, give us even a few small techniques, hints, stuff like that.
I think one of the big ones is not flossing. By not flossing, it's keeping dirt, old food between the teeth, and that can easily start the process of decay. Another one is brushing but not taking the time to actually get all the food away. Yeah, braces are on, and so you got to spend a little more time than what you're used to in terms of taking time to brush. So it's so important that you really want to spend that time to ensure that all the food and plaque that may be sitting around the teeth, and especially in between, are removed so that the gums are healthy and decay is not an issue. In addition, we encourage all our patients, with or without braces, everybody needs to go to see the dentist every 6 months, because the dentist is able to reach areas that our toothbrush would not normally reach and be able to remove all the plaque and calculus there.
Even did you just say to go to the dentist to do a cleaning while you have braces? So you see the orthodontist once every month, 3 weeks, 6 weeks, whatever it might be, based on a particular, you know, circumstances. But you still every 6 months, or if your dentist thinks that you should come every 3 months because you're a person who accumulates more saliva and more, a plug. Either way, whatever the dentist says your time frame is, 6 months, let's say, is the average. You still need to do that also. So you don't not see your normal dentist during that time.
Yes, it's important to see the dentist every 6 months. And as you said, when the dentist sees the patient, sometimes there is need to see them more frequently, maybe every 3 months. And at Sunny Smiles Orthodontics, if the patient goes for a cleaning and the dentist does not give us the clearance to go on with treatment, we actually will stop treatment until the dentist says it's okay to go back home.
Okay, all right, wonderful. So basically flossing, very important, just to reach all the area. And of course, I'm very sure that as a child or an adult comes in, you physically show him how to do it and see whether he does it correctly. Basically, you drill, practice, coach him as he has the braces on it, and remind him of exactly where to pay attention and stuff like that, right?
Yes. As a matter of fact, when a patient comes in our office, the first thing we do, we take up the ties and we look at the gums. If the gums are red and inflamed, or the patient has not been brushing well, we will do a toothbrushing and flossing demonstration, and then send the patient to the bathroom to go take care of the teeth. We call it give the teeth tender loving care. And it's a way of reinforcing to the patient the message that the oral hygiene is a big component of the treatment.
Yeah. Well, the oral hygiene, obviously, I have found out lately, even though we do learn it in school, it seems to be just so much more affecting people than they think. They think it's a matter of bleeding, bad breath, and down the road losing your teeth, which is all very bad. Nobody wants to lose a teeth because it's expensive to put them back in, and we want to keep our own body parts. It's just a natural, makes sense thing. However, we have to admit that dentists became very, 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 very good in putting implants. So it's not anymore like George Washington, who apparently was wearing a wooden tooth, that must have been awful. So it is better if you have the money, which, even if you do have the money, don't you want to spend it on a vacation to Hawaii rather than on implants, right? But there's one thing which most people simply do not realize, and it took me a long time, only recently I realized, that little yellow reddish pus which is in the mouth while you have an infection, it's dripping into the blood all the time because the mouth is the gateway to the blood vessel. It poisons your liver, your kidney. Ladies have premature babies, underweight. In California, there was even a stillborn baby. The immune system goes down like crazy, so the next flu season will hit you harder. You get exhausted, tired, fatigue, heart problems. Of course, we knew about that for a long time, but people didn't take it serious. Even brain damage it just like makes sense if that blood, that yellow, ugly, reddish pus goes in. So if you see a person coming to you with already some type of gum disease, where it is more difficult to maintain it with the braces, very obviously you need to put your foot down before. Besides that, the gum disease will eventually move his teeth again anyway. So, it's what usually happens shortly before you lose them. They start moving all over the place, right? So the people don't realize that that's so important. What I just said here about the gum disease, is that true, or should that be amended a little bit?
No, it should not be amended. If anything, it should be reinforced. There is the saying that says the mouth is the gateway to the body. That is very true regarding oral hygiene. Wherever there is infection in the body, whether it's in the mouth or elsewhere, it has the potential to affect all other parts of the body, because there is the same blood stream that flows through our parts of the body. But in addition to that, periodontal health has been known to have a reasonable correlation with cardiac health and with health of other parts of the body. Therefore, if we learn to take care of our teeth, if we learn to keep good oral hygiene, we will in turn be improving the general and overall health of the patient, of the person. It's not only patients, everybody.
Good. Well, I'm sure that you make sure that you play a good truant officer with your patients while they're in your treatment when it comes to dental hygiene, because you have mentioned it many times throughout many of the interviews. It seems to be a very big part, and so it is. Thank you very much.